is very common subject in pediatrics, that is urinary tract infection, which is called UTI. The UTI considered as a risk factor for the development of the renal insufficiency or end-stage renal disease in children, especially if it is not perfectly treated. The prevalence of the UTI, it is occurred in 1% of the boys and 1 to 3% of the girls. That means it is more common in the girls. The prevalence varies with age. That's during the first year of life, the males more than female, especially in the uncircumcised males, with male to female ratio of 2 to 5 إلى 1 of the each female, and every 5 male to 1 female. While beyond the age of 1 to 2 years of age, the female is much higher than male, with male to female ratio is 1 to 10. As you see in the children, during the first year of life, the male more commonly affected with UTI than female, about 2 to 5 times more than the female. While in the children beyond 1 to 2 years of age, the female are more commonly affected by the UTI than males with ratio of 1 to 10. That means that 10 times in the female than in the male. The causative microorganism for the UTI, including in the girls, 75 to 90% it is caused by the E. coli. In the female, 75 to 90% of the UTI are caused by the E. coli, which is followed by the Klebsiella species and the Proteus species. While in the boys, the E. coli is also the most common cause of the UTI in the boys, but in the boys, some studies shows that in the boys older than 1 year of age, the Proteus and E. coli are equally as a cause of UTI. So, in general, in both genders, the UTI is the most common cause of the E. coli in both male and female. But in the boys more than 1 year of age, the Proteus and E. coli are equally as a cause of the UTI. The adenovirus and other viral infection can occur in both sexes, especially as a cause of the hemorrhagic cystitis. That means cystitis with frank hematuria or gross hematuria. So the most common microorganism for the UTI in the girls in all ages is the E. coli is the most common, and followed by the Klebsiella and the Proteus. While in the boy, also the E. coli is the most common, but in the children in the boys older than 1 year of age, the Proteus and E. coli are equally causing UTI. The virus occurs in both sexes, especially the adenovirus, and which is causing the hemorrhagic cystitis. Pathogenesis, or how the baby gets UTI. The UTIs are caused primarily by colonic bacteria. Nearly all the UTIs are ascending infection from the colonic bacteria, which means the normal flora in the colon, which is passed through the stool and then enter to the urinary system, causing the UTI. Nearly all UTI are ascending infection. Ascending infection. All of the UTIs are ascending. That means the colonic bacteria from the anal region will be entered through the urethra to the urinary system, then causing urethritis, then to the bladder causing cystitis, then ascending to the kidney causing pyelonephritis. The bacteria arise from the focal flora, colonize the perineum, and enter the bladder by the urethra. And then in the uncircumcised boy, the pathogens arise from the flora, which is occurred beneath or growth beneath the prepuce. So the uncircumcised boy is a strong risk factor for the development of the UTI in the male, and the circumcision an important protective way to prevent UTI in boy child. In some cases, the bacteria causing cystitis ascending to the kidney to causing pyelonephritis, as I said, and rarely, very rarely, the renal infection occurs by the hematogenous spread as endocarditis or in some units. So the most of the infection, it is ascending from the colonic bacteria to the urethra, then to the bladder, then ascend to the kidney causing pyelonephritis. But in rare condition, the pyelonephritis might occur in the hematogenous spread, especially in association with endocarditis or in some neonate below 1 year, below 1 month of age. The risk factors for the development of the UTI, including the female gender. The female gender itself as a strong risk factor for development of the UTI because of the very near opening of the urethra and the anus. Uncircumcised male, as I said, vesicourethric reflex. Vesicourethric reflex, it is mean the retrograde passage of the urine from the bladder during voiding, from the bladder to the ureter, then to the kidney because of presence of the obstruction distal to the passages of the urine. And this will be discussed in the next lecture, inshallah. Poor toilet training in the children, which is toilet training, it is mean there is delay in the passage of the urine. And this resulting in the accumulation of the urine in the bladder and giving time for the bacteria to be overgrowth to reach to the infectious range and causing UTI, cystitis, then raised to the ascend to the kidney causing pyelonephritis. Voiding dysfunction when there is obstruction in the urethra or narrowing in the urethra, stricture in the urethra, this will resulting in the poor urine stream and resulting in the UTI. Obstructive uropathy in the same mechanism, urethral catheterization due to the aseptic technique, due to the septic technique, septic technique of the catheterization, which resulting in the urethral infection. And whipping from the back to the front in the girl. As I say, it is near the opening of the anus and the urethra. So during the toilet wash, the female whipping from the back to the front, that means taking fecal material into the urethra. So almost always we advise families for the correct cleaning from the front to the back. From the front to the back to avoid this condition which is causing UTI. Other risk factors including tight clothing, underwear, especially in the female, pinworm infestation because it's causing itching at the region, which is causing abrasion or scratching, which is lead to the overgrowth of bacteria. Constipation, the constipation, it is causing the UTI because in the impacted fecal material in the anal and colonic region, it will be resulting in the dead space or sac-like in the bladder, which cannot be voided completely, which resulting in the stasis of the urine in the bladder, and when there is stasis of the urine, there is overgrowth of the bacteria, which leads to the infectious level. Anatomical abnormalities like labial adhesion in the female, which is resulting in the decreased urine output, and neuropathic bladder, neurogenic bladder, which is resulting in incomplete empty of the bladder during the voiding, and this also resulting in the stasis of the urine and infection. Other risk factor which is not occur in our society, alhamdulillah, like sexual activity, adolescent, hyperactive female, sexually hyperactive female, and also a pregnancy in the adolescent, which are not so common in our society. Classifications of the UTI, we have three basic forms of UTI in the pediatric. The first one, pyelonephritis, cystitis, and asymptomatic bacteriuria. These are the three types of clinical types of the UTI in children, and we will discuss it in detail. Focal pyelonephritis, which is called nephronia, and renal abscesses are less common in the pediatric. Focal pyelonephritis, which is called nephronia, that's an infection of the part of the kidney, parenchyma, and pelvis, not generalized, or collection of the pus in the kidney, which is called renal abscess, are less common in children. The most common types are pyelonephritis, cystitis, and asymptomatic bacteriuria. The pyelonephritis, it is mean infection of the renal parenchyma, including the glomeruli, interstitium, and renal pelvis. That's what mean by the acute pyelonephritis. It's infection of the renal parenchyma, including the tissue of the kidney in addition to the renal pelvis. While bilitis is infection of the renal pelvis only. Bilitis is infection of the renal pelvis only without involvement of the renal parenchyma. Acute pyelonephritis, which is might cause pyelonephritic scarring, which is the renal injury resulting from acute pyelonephritis, which resulting in the fibrosis in the kidney parenchyma, which called the scarring. We have fibrosis in the renal parenchyma causing scarring, not caused fibrosis, which is resulting in the scar, and this is resulting from the pyelonephritis, which is the main cause of the end-stage renal disease, which is resulting from the pyelonephritis. The main risk of the pyelonephritis in the pediatric, it is development of the pyelonephritic scarring, renal scarring, and then loss of the renal function, and ultimately would result in the end-stage renal disease. What are the clinical features of the pyelonephritis? The patient might have any of the following feature or all of the following feature, either all or any of one. Common manifestation, abdominal, back, or flank pain. It is common, especially in the children. Fever, which is maybe the only manifestation. Sometimes the patient presenting with only fever, and when they're searching for this unknown fever, the cause will be the pyelonephritis. Malaise, nausea, vomiting, and occasionally diarrhea. Also, they are non-specific manifestations which are commonly occur in the pyelonephritis. In the newborn, can show non-specific symptoms such as poor feeding, irritability, jaundice, and weight loss. So the patient might manifest with all of these manifestations or any one of these manifestations, not necessarily all of the manifestations. Commonly present with abdominal, back, or flank pain, followed by the fever. Malaise, nausea, vomiting, and occasional diarrhea, it is not a specific manifestation. And in the newborn, most of the cases present with non-specific and require high index of suspicion, because the symptoms occur in many other diseases, which including poor feeding, irritability, jaundice, and weight loss. Renal abscess can occur following a pyelonephritic infection caused by the unusual pathogen, or maybe secondary to the hematogenous infection, especially in the Staph aureus. This is regarding the pyelonephritis. As I said, it's infection of the renal parenchyma and renal pelvis. If there is involvement only the renal pelvis, it is called bilitis. And the manifestation mainly presenting with abdominal pain, fever, or non-specific manifestation. About cystitis, it is mean infection of the urinary bladder only. Cystitis, It is mean infection of the urinary bladder only, and the patient usually is presenting with lower urinary tract manifestation. While as you saw in the pyelonephritis, we don't say the patient have dysuria, frequency, urgency. These manifestations of the lower urinary tract infection, which is not occur in the pyelonephritis. Please, this is very important in the clinical and in the theoretical questions. The upper urinary tract infection, renal involvement, it is not associated with urinary manifestation, including dysuria, frequency, urgency, or even hematuria. But the cystitis, which is in the lower urinary tract infection, which is only involvement of the bladder, usually associated with dysuria, urgency, which is urgent desire for passing of urine, frequent passage of the urine, suprapubic pain, incontinence, malodor, urine. These are the main manifestation of the lower respiratory tract infection. Lower urinary tract infection. The cystitis does not cause fever. This is very important point in differentiation between the upper and lower urinary tract infection. Pyelonephritis associated commonly with fever, flank pain, abdominal pain. There is no dysuria, urgency, frequency, or suprapubic pain or incontinence. But the cystitis, it does not cause fever, and usually associated with dysuria, urgency, frequency, and other manifestation of the lower urinary tract infection. The malodor urine, also the cystitis does not cause renal injury unless there is ascending infection through the ureter to reach the kidney, then it will resulting in the pyelonephritic scarring and renal injury. And malodor urine is not specific for UTI. Not all the, we face a lot of family, they are complaining from the malodor urine, and they believe that it is UTI. Malodor urine, it is one of the presentation of the UTI, of the cystitis, but it is not necessary. That means not all patients with malodor urine, they have UTI. Acute hemorrhagic cystitis, it is often caused by the E. coli, but it also caused by the adenovirus type 11 and 21. And the adenovirus cystitis is more common in the boys. It is self-limited condition with hematuria lasting only for approximately 4 days. It is common manifestation in the male. The baby have the frank hematuria or gross hematuria for about 4 days, then it is self-limited and resolved spontaneously. It is mostly caused by the adenovirus type 11 and 11. The third type of the UTI is asymptomatic bacteriuria. From its name, that means there is overgrowth of the bacteria in the urine, but without clinical manifestation of whether upper or lower urinary tract infection. So it is called asymptomatic bacteriuria. It is a positive urine culture without any manifestation of infection. It is the most common in girls and rare in the boys, and the incidence is less than 1% in preschool and school age girls. It is benign condition and does not cause renal injury except during pregnancy, in whom if left untreated, it can result in the symptomatic UTI and then renal injury. So asymptomatic bacteriuria, benign condition, does not cause renal injury, no need for the treatment, except in the pregnancy. If it's left untreated, it can result in the symptomatic UTI and then causing renal injury. How we diagnose UTI? The UTI is suspected based on the symptoms or finding on the urinalysis or both. The main diagnostic way for the UTI in children, depending on the clinical manifestation of the upper and lower UTI, or on the urinalysis, general urine examination, or both. The urine culture necessary for the confirmation and appropriate therapy only, just for the confirmation of the infection and for the appropriate therapy by the recognition of the causative microorganism and then giving a suitable antibiotic to resolve this infection. So the urinary culture is confirmatory and not diagnostic. This is important in the MCQ. Urinary culture, it is confirmatory, not diagnostic for the UTI. Very important point in the diagnosis of the UTI, it is depending on the urinalysis. And the result of the urinalysis is depend mainly on the way of the urine collection. Most of the conditions, there is overdiagnosis of the UTI because of the inappropriate way of the urine collection. As you know, the region is septic region containing a lot of the skin contamination in the perineal region, and this contamination will give you false impression that the patient have UTI. So the way of the urine collection, it is very important. We have three ways for the urine collection. The first one, it is midstream urine sample. From its name, midstream urine sample, it is mean that in the toilet training patient, يعني البيشنت يفتهم عليك وكان obey order يمكن يتبع التعليمات. Explain to the family that the baby at the beginning pass part of the urine out of the collecting tube. Then from the midstream, the baby is from the midstream we taking the urine sample for the urine collection. واضحة؟ يعني كل الأهل ياخذ هذا التيوب مال اليورين كولكشن أول مرة يتبول خارج التيوب فيو سي بعدين ناخذ اليورين سامبل لا من نهاية اليورينيشن ولا من بداية اليورينيشن because at the beginning there is contamination of the skin or the opening of the urethra so it will be washed out by the urine تروح يغسلها اليورين ويطلعها هاي البكتيريا فناخذ من الميد ستريم فاذا اكو بكتيريا اذا اكو فايندينج هي جايتنا من urinary bladder and not contamination. It is used in the toilet training children, as I say. In the female, the introitus should be cleaned before obtaining the urine specimen to avoid the contamination. عادة, the cleaning occurs by the water and soap only. Water and soap only, cleaning the introitus region, then taking the midstream urine. In uncircumcised male, the prepuce اللي هي fold of the skin الموجودة, the prepuce نسميها must be retracted before obtaining the urine specimen to avoid the contamination with the bacteria which is usually a growth beneath the prepuce. Prepuce هذا السكن part الموجود retracted backward before taking the urine sample to avoid the contamination with the bacteria which is usually or microorganism which is usually present beneath the prepuce. Second way is suprapubic or aspirate or urethral catheterization. This is need for the accurate diagnosis of the UTI which the sample in this condition, it will be free of any contamination. ما في any contamination. لأن the sample ماخذ through the catheterization from the bladder or from the suprapubic puncture, يعني needle يدخلوها بالsuprapubic area to the bladder and taking the sample directly from the bladder without any contamination. It is usually used in the non-toilet trained child because of the difficult to obey instruction of the midstream urine collection. Third one is the collection bag. Third one, collection bag. The collection bag شايفيها يمكن أعتقد بالمختبرات الرواية. It is adhesive, sealed, sterile bag. bag كيس نايلون هو زين بلاصق ستيرايل نفتحها من الباكيت هنا. بعد ما نفصل المنطقة بالووتر اند سولت نجيب هذا الكيس ندخله باليوريثرا زين و adhesive to the surrounding skin زين especially in the poorly toilet training. It is applied to the genitalia after disinfection of the skin, and the result of the urine culture dependable only if the culture is negative or if a single uropathogen is isolated. هنا انتبه عليه رجاء. قلنا احنا المنطقة تكون contaminated containing a lot of the bacteria or microorganisms because of the poor cleaning. So إذا جبت اليورين باج collection urine bag وخليناها على المنطقة زين وسوينا الكلتشر فإذا طلعت لي positive for multiple microorganisms that means it is undependable ما نعتمد عليه. إذا الكلتشر طلع لي multiple microorganisms okay بالculture it is mean contamination from the skin surrounding skin rather than real infection. بس إذا واحد عنده symptom وشكيت بي أنا UTI وطلعت لي urine culture by the collection bag is negative, this means rule out UTI. So it is dependable only if the culture is negative. واضحة هاي العبارة خاف واحد ما منتبه لها. It is dependable only if the culture is negative. يعني معناها أنا عندي suspicion of the UTI وطلع لي الculture بالadhesive bag is negative, so it is no UTI. هذا هي النقطة. بس إذا طلع لي positive of multiple microorganisms, it is mean contamination. إذا طلع لي positive for single uropathogen, also I depend as UTI. لأن contamination عادة يكون in multiple microorganisms. فإذا طلعت لي so it is dependable as important negative to rule out the UTI or important positive only if there is single uropathogen is isolated. واضحة هاي العبارة؟ مهمة هاي شوي. Positive culture of multiple pathogens, as I said, can result from the skin contamination, especially in the girls and uncircumcised boys. The collected urine should be examined and cultured as early as possible because if the urine remains at the room temperature for more than 60 minutes, will causing overgrowth of a minor contamination, and this will be giving the false impression of the UTI. If there is no time for the exam of the urine, so refrigeration is a reliable method of storing the urine until it can be cultured. يعني جزء انت بالليل ماخذ اليورين سامبل وما عندك مختبر يسوي لك الكلتشر، فمن هذا الصبح اذا تخليه بالروم تمبريتشر راح يصير overgrowth of minor contamination وهنا راح تعتمد له falsely as UTI. فتخليه بالثلاجه ثاني يوم الصبح الى ان تسوي له الكلتشر it is no problem. But if it remain in the room temperature for more than 1 hour, this will causing overgrowth of the minor contamination. What are the positive results of the urine analysis to depend as UTI? Positive results. لين أقول هذا اليورين is positive for the UTI. If there is positive nitrates and leukocyte esterase test in the urine, Or there is microscopic hematuria, which is common in the acute cystitis, but microscopic hematuria alone does not suggest UTI. And white BC cast, which is suggest renal involvement, or what we call pyelonephritis. So these are 3 points must be present in the general urine examination to say that the patient have UTI. Positive nitrate and leukocyte esterase test, microscopic hematuria in the hemorrhagic cystitis or acute cystitis, sorry, and white BC cast, which is suggest renal involvement. If the child is asymptomatic and the urinalysis is normal, the UTI is unlikely. The patient asymptomatic, when the general urine examination normal, so it is unlikely. But if the child is symptomatic, the UTI is possible even if the urinalysis result is negative. يعني مو دائما إذا urinalysis أو general urine examination negative, it is ruled out UTI. لا, إذا كان البيشنت symptomatic, the UTI is still possible even if the urine examination is negative. Pyuria is referred to the presence of the leukocytes on the urine microscope. It is suggest infection, but infection can occur in the absence of pyuria. Yani pyuria, it is not necessary for the diagnosis of UTI, but when it is present, it is mean infection. It is confirmatory more than diagnostic, like the culture. And pyuria can be present without UTI, as I said. Steroid pyuria, it is mean positive leukocytes in the urinalysis with negative urine culture. هذا خاف تسمع فيها. Steroid pyuria is negative, positive leukocyte, white BC in the urine with negative urine culture. It is may occur in partially treated bacterial UTI, viral infection, renal tuberculosis, renal abscess, UTI in the presence of the urinary obstruction, urethritis as a sexually transmitted infection, and an inflammation near the ureter or the bladder as in the appendicitis, Crohn's disease, or interstitial nephritis. These are causing of the steroid pyuria, that's mean the presence of the leukocyte in the urine without positive culture on the positive result on the urine culture, only presence of the whites. When I depend urine culture is positive for the diagnosis of the UTI. This is very, very, very important point because as I said, we have over diagnosis of the UTI because of 2 causes. The first one, inappropriate way of the urine collection and contamination, then regarded as UTI. والسبب الثاني هو false interpretation for the result of the urine culture. فهنا نقاط جدا مهمة. The result of the urine culture to be depend as UTI, diagnosis for UTI is depend on the way of the urine collection. In the suprapubic or catheter sample, as I said, the suprapubic and catheter sample, it is free of contamination because you take the urine sample directly from the bladder. So the child is considered to have UTI if there is culture, if the culture shows more than 50,000 colonies of the single pathogen, or there are 10,000 of the colonies of the single pathogen and the child is symptomatic. So, على مود تعتبر البيشنت هذا عنده UTI وانت جامع اليورين by the suprapubic or catheter sample لازم عندك single pathogen, single type of the bacteria, مو multiple bacteria of the colony count more than 50,000. أو البيشنت عنده single pathogen of colony count of the single pathogen 10,000 or more in addition to the symptom. the patient is symptomatic. أو catheter sample لازم عندي شرطين حتى أقول البيشنت عنده UTI. أول وحدة low single pathogen more than 50,000 colony count أو البيشنت symptomatic with colony count of 10,000 and more for single pathogen. So can we regard as UTI. بينما بالcollection bag sample the child is considered to have UTI if the urinalysis result is positive, the patient is symptomatic, and there is single organism culture with colony count more than 100,000. مستعجلة لازم عدة أما 50,000 colony count of the single pathogen أو البيشنت symptomatic وعدة colony count of 10,000 10,000 of the single pathogen. هذا بالسوبرابيوبيك أو بالكاثيتر. بينما بالكولكشن باك لازم عندي ثلاث شروط تتوفر باليورين كلتشر. يلا أقول هذا البيشنت عنده UTI. أول وحدة لازم الجنرال يورين اكزامينيشن بوزيتيف. ثاني وحدة البيشنت لازم symptomatic. وثالث وحدة I have single organism culture with colony count more than 100,000 لأن قلنا بالكولكشن باك the possibility of the contamination is very high. فإذا تعذر عليك تسوي كاترايزيشن وسوبرابيوبيك فانكشن واعتمدت على الكولكشن باك لازم عندك ثلاث شروط ذني يلا تقول البيشنت عنده UTI وهاي جدا جدا مهمه شباب وتنسالون بيها هوايه. اول وحده لازم بوزيتيف جنرال اكزامينيشن، ثاني وحده لازم البيشنت سيمتوماتيك، وثالث وحده البيشنت لازم عنده single organism culture with colony count more than 100,000. Loss of any of these criteria, it is the collection back sample not dependable. Okay, loss of any of these criteria واحدة من الثلاثة it is mean the collection back sample is undependable. ما نعتمد عليه for the diagnosis of the UTI. So we require the confirmation of the infection with catheterized sample or by the suprapubic puncture. Treatment of UTI is in the acute cystitis. The treatment of choice, the acute cystitis should be treated promptly to prevent the progression to the viral nephritis. As I said, it will be ascended, the infection will be ascended through the ureter to the kidney, resulting in the viral nephritis, then resulting in the scarring and end-stage renal disease. If the symptoms are severe, the treatment is started before getting result of the urine culture, but if the symptoms are mild or the diagnosis is doubtful, not sure about the UTI, the treatment can be delayed until the results of the culture are known. So the cystitis treatment is very important to prevent development of viral nephritis, while if the symptoms are severe, start the treatment before getting the result of urine culture. But if it is mild or the doubtful about the diagnosis, not sure about the diagnosis, so the treatment can be delayed until the result of the culture are known. The culture can be repeated if the results are uncertain. What is the empirical antibiotic therapy for the treatment of the acute cystitis? Including the drug of choice, which is commonly used, is trimethoprim sulfamethoxazole, or trimethoprim for 3 to 5 days are effective against the E. coli. وإحنا قلنا the most common cause of the UTI is the E. coli. So the drug of choice, before waiting of the culture result, you can start with trimethoprim sulfamethoxazole or by the trimethoprim only. Nitrofurantoin is effective and has advantage of being active against Klebsiella and Enterobacter organism, which are the second common causes of the UTI. So if you suspect presence of the Klebsiella and Enterobacter organism, you can start with nitrofurantoin. Amoxicillin also is used but has a high rate of bacterial resistance due to the overuse of the amoxicillin in the society. So the drug of choice is trimethyl sulfamethoxazole, and second choice is nitrofurantoin, which is effective against the E. coli. In addition, is its effect against the Klebsiella and Enterobacter organisms. Pyelonephritis or febrile UTI, as I said, when there is fever with UTI, it is mean pyelonephritis. If there is no fever with UTI, it is mean cystitis. So, indication of hospitalization, including dehydration, vomiting, inability to drink fluid, patient 1 month of age or younger, complicated infection, possibility of the urosepsis. These are the indications of admission for the patient with febrile UTI. The treatment is IV fluid, broad spectrum antibiotic for 7 to 14 days, which are effective against the causative microorganism, and this antibiotic should have high concentration, high renal concentration. يعني the antibiotic should be of the high tissue level for the kidney and should be used for 7 to 14 days. And these antibiotics including third generation cephalosporin, including IV ceftriaxone or cefotaxime for the 7 to 14 days, or IV ampicillin with aminoglycoside gentamicin for 3 to 5 days, and the nitrofurantoin. Nitrofurantoin, it is not commonly used in the treatment of the febrile UTI or pyelonephritis because it does not achieve significant renal tissue level, and the aminoglycosides are effective against Pseudomonas species, and alkalinization of the urine with sodium bicarbonate will increase its effectiveness in the urinary tract. Most common, usually, we use the sodium bicarb powder in addition to the aminoglycoside because it is very effective for the treatment of the it will increase the efficacy of the aminoglycoside gentamicin against Pseudomonas. Oral fluoroquinolone اللي هي ciprofloxacin and levofloxacin are very effective for the management of treatment of the resistant microorganism, but particularly Pseudomonas, but it is not used in the children younger than age of 17 years because it will resulting in the cartilage destruction. So in a erythrobody. So the السبرودار الموجود هسه كمالي اللي هو واحد من الفلوروكوينيلون اللي هو السبروفلاكساسين اسمه العلمي والليفوفلاكساسين are effective against the resistant strains, especially in the Pseudomonas, but it is contraindicated in children younger than 17 years of age because its effect on the joint cartilage resulting in the erythropathy due to the cartilage destruction. So in the febrile UTI, commonly we depend on third generation cephalosporin or ampicillin and gentamicin with sodium bicarbonate. And nitrofurantoin, other choice, but it is not routinely used because it's low saturation level in the kidney. And the fluoroquinolone, it is are contraindicated in children younger than 17 years of age. Renal or bilirenal abscess or infection in the obstructed urinary tract, they are require surgical or percutaneous drainage plus antibiotic therapy to get rid of the abscess material. Small abscesses may be treated without a drainage, only by the antibiotic therapy. Few words about the management of the recurrent UTI, which is very common problem, especially in the female, many of the females. they complaining from the recurrent UTI. So most of the recurrent UTI, there is an underlying cause which is result in this recurrency of the infection. So the first point in the management were identification and treatment of the underlying causes like the bladder bowel dysfunction, severe constipation, neuropathic bladder, UTI stasis and obstruction, severe vesicular reflex, or urinary calculi, renal stone. Management of the recurrent UTI also including the prophylactic antibiotics with the trimethoprim or nitrofurantoin at 30%. 30% of the therapeutic dose once a day. يعني ثلث الدوز اللي استخدمناها بالتريتمنت نستخدمها as prophylactic مرة واحدة باليوم. Trimethoprim, sulfamethoxazole, amoxicillin, or cephalexin can also be effective, but the risk of the breakthrough UTI may be higher because of the bacterial resistance, because these drugs are commonly used in the society for many infections, abused by the family or by the substaff. So there is high rate of the resistance. So you depend on it as prophylactic, but the infection might be occur because of high risk of the bacterial resistance to these antibiotics. That's all about the UTI. Thank you for your nice attention.